This is a note for an established office patient. It contains 101 words. To figure out what it's worth, we need to determine the level of care by taking apart the history, the physical exam, and the medical decision-making, and plugging that information into this table, which shows the documentation requirements for established office patients. For these encounters, only 2 out of 3 key components are needed. You can use either the 95 or the 97 rules. In this case, the 97 rules give a more definitive answer, so those are the ones we'll use. Starting with the history, this is the table that tells us what level of history has been recorded. Here we do have a valid chief complaint, follow-up visit for hypertension and diabetes. But then all we say is the patient feels fine for the interval history. This gives us no elements of HPI, PFSH, or review of systems, so we qualify for no level of history. The next step is to check the physical exam. Looking at the physical exam and using the 97 rules, remember the exam is based on the number of bullets recorded from the various organ systems. Here we get 1 bullet for documenting 3 vital signs, and 1 for describing the patient's general appearance, 1 for examining the neck, 1 for checking the thyroid, and 1 for listening for carotid bruits, 1 for listening to the lungs, and 1 for assessing respiratory effort, 1 for listening to the heart, 1 for palpating the PMI, and 1 for checking the lower extremities for edema. We get 1 cardiovascular bullet for assessing the pedal pulses, and 1 musculoskeletal bullet for looking at the digits for cyanosis or clubbing. This gives us 12 bullets, which means we would qualify for a detailed physical exam using the 1997 E&M guidelines. The next step is to check the medical decision-making. Looking at the medical decision-making and starting with the problem points first, here we have 2 stable problems of hypertension and diabetes, which are worth 1 point each. Next, we have suboptimally controlled hyperlipidemia, which is worth 2 problem points. This adds up to a total of 4 problem points for this encounter. The next step is to check the data points. Looking at the data points, here we looked at labs, and we also ordered labs, which gives us only 1 data point. The next step is to check the risk. Looking at the risk, this encounter easily qualifies as being of moderate risk. We have 2 stable chronic illnesses in the hypertension and the diabetes. We also have 1 or more chronic illness with mild exacerbation or progression in the form of the hyperlipidemia. So no matter how you slice it, this is definitely a moderate risk encounter. So we have 4 problem points, 1 data point, and moderate risk, and since only 2 out of 3 dimensions are needed, this adds up to moderate complexity medical decision-making. Going back to our documentation grid, we have no history recorded, a detailed exam, and moderate complexity medical decision-making. Remember, for these encounters, only 2 out of 3 key components are needed. That means, in this case, the documentation supports the 99214 level of care. Going back to our note, remember, only 2 out of 3 key components are needed. We have an invalid history, a detailed physical exam, and moderate complexity medical decision-making. Again, we qualify for the 99214 level of care based on this documentation. So here it took us 101 words to earn $102.27, which works out to about $1.01 per word, which is very efficient documentation. Thanks for watching Case of the Week. If you want to learn how to document your encounters this efficiently, consider signing up for one of our web-based E&M coding curriculums. We have several different options to match any practice pattern. For E&M coding education from multiple providers, let us build you a customized E&M compliance web portal, which provides centralized, trackable, and verifiable E&M coding education for multiple doctors. Thank you.